Welcome to the High Tech Council HR Exchange kickoff for our new season for 2020 to 2021. We are virtual, and welcome to the new reality, right? So today we're going to be talking about managing in a safe, managing the return to work in sort of the COVID era, return to workplace, a safe workplace. So welcome everyone. So what we're going to do is for the next 50 minutes or so, go through this presentation. It's a PowerPoint. We'll go through those slides. We have a period of time for questions, and you can post questions to this webinar. We'll go through those as much as we can. I can also field questions afterwards. We also have a brief poll as you're putting your questions together. That will be after I go through my presentation. But so as you think of your questions during the presentation, you can certainly post those, and then we'll get to them at the end. So I hope that's acceptable to you folks. There is no question, as we get started today, that HR has a new reality, and that new reality is COVID. It's been going on since, of course, since February or March of 2020. It seems like that last 6 months has been the longest 6 months of most of our lives. You know, it started with the news reports from China, of course, and then to the West Coast, and we thought it was a West Coast issue, and then it made its way across the country. And then suddenly, even though there was some resistance here in New Hampshire, we had a stay-at-home order. First, there was the state of emergency, then a stay-at-home order, and what that all meant for most workplaces. And I'd like to hear from you folks as to what that was like. But I think the commonality there was that businesses simply shut down. And now we're in a stage of businesses are reopening, some phased to 50 to 75, and as now close to 100%. Some are, as I was talking to folks, some are going to be remote through the middle of 2021. We'd like to hear from you folks on that as well. But lots of issues coming up, and we're going to talk about those because it's not just about hand washing and wearing masks, but it's also issues related to quarantining, business travel, training your supervisors as to, you know, detecting illness in the workplace and dealing with employees, protecting the records, medical records and the like. But most of all, it's making your employees feel safe as they return to work, because I'm sure you've experienced it. I've heard from a lot of clients. Some employees are simply reluctant to return to work. Now, the cynical side of you could say it's because, well, they were comfortable on unemployment or they enjoyed the summer at the beach. But the reality is many of them are concerned about the virus, either because they've got a vulnerable family member at home or they themselves have an underlying health condition. There is a small number of employees out there that are perhaps taking advantage of this pandemic, but I think that truly is a small number. So let's get to it. So managing a safe return to the workplace in the COVID-19 era. And for those who remember, and perhaps I'm dating myself a little bit, for those who remember the Dustin Hoffman movie, The Marathon Man, the question is it safe? Is it safe to return? And that's a question your employees may be asking you. That's a question that their family members may be asking you. That's something government officials may be asking you. And I'm going to talk about that because we've been dealing with clients that have had interactions with the Department of Public Health on a local level, on a state level, and yes, OSHA audits dealing with COVID-19 issues. So COVID-19, in addition to the obvious, which is the healthcare devastation that the virus has caused and continues to cause, it has turned the workplace truly upside down. And we'll talk about that. Let's go through some of the impact upon the workplace. I mentioned a minute ago the stay-at-home orders, and that was truly stay at home. I don't know about you folks, but to me the barrier, the seclusion, the peace that you would have in the workplace before, perhaps you may have had a desk, you may have had an office, you may have had a separate area. You may have had a time that at a certain time after normal work hours, I'll close out emails, do this or that. But with the stay-at-home orders and people working from home, the differences between the office or the place of work or the workplace and home evaporated. It all became work, at least for some employees. The closure of non-essential businesses were part of the stay-at-home orders. So unless your business was deemed to be an essential business, your business had to be closed. And that meant you had to get your employees equipped, and we'll talk about that in a second, to work from home to the extent they could. Otherwise, they were furloughed. Perhaps some were laid off or even terminated. We'll talk about that too, because there have been shifting sands in that regard. A ban on non-essential travel, and that was principally business travel, but now that has evolved into personal travel issues. We'll talk about that as well and the impact upon the workplace. And again, the scramble to equip employees for remote work. How many of you had an adequate number of laptops, IT professionals for support, tablets, smartphones, and the like to equip all of your employees that you needed to have work remotely? And I would venture a guess and say very few of you did. If we all had it to do over again, we would have bought stock in Best Buy or Home Depot during COVID, or at least the beginning of the crisis, because those were the very active businesses. So what were some of the other issues that came up with sort of the COVID impact, and at least initially with on the workplace? Monitoring remote work. I have a brother and sister. I'm from a big family. I have a brother and sister, both lawyers. And my brother in DC is the managing partner at his firm. And he said the issue that they had was they required staff to, in real time, log in as to what they were doing. And that seems a little Orwellian, 1984. There was a design behind that to find out and basically keep track of people to make sure that they were working. That is an issue that some employees did resist. That was an issue that some employers actually used for purposes of monitoring the employees and also keeping track of them, and then later perhaps deciding who was going to stay and who was going to go when they had to thin the workplace. Wage and hour issues. Several people in our group, our employment group here at the firm, have had to deal with them. Questions like that with HR professionals. How do you track the hourly employee? Log in obviously is the easiest thing, the beginning of the day, the end of the day, and any bona fide work break greater than 20 minutes. But what about your salaried employees? Well, for the salaried non-exempt employees, we know we're tracking their time as well. For the salaried exempt employees, do you need to track their time? Well, the only issue that came up in that regard was to the extent you need to track time for purposes of accrual of paid leave time, but that was less of an issue. The only issue that really came up with salary exempt employees was when they were taking time off and whether or not you could prorate salary and so on, or if they were taking FMLA time or FFCRA time. We'll talk about that. Potential misconduct with remote access. The EEOC says that 1/3 to as much as 1/2 of sex harassment cases or related misconduct arise out of misuse of electronic equipment tied to the employer. Sadly, that's when it's the idle hands and idle minds of the devil's workshop, and that's what sometimes was happening when people had way too much time on their hands, or had access to, or no one looking over their shoulder. But as you all know, as HR professionals, you can certainly look over someone's shoulder when they're using your computer system, even though they're working remotely. So there was greater burden on HR professionals and their IT colleagues to monitor the activities of employees to make certain that not only there was no discrimination or bullying or harassment, but also potential misconduct with regard to theft, potentially. And then, as we say, 2 bullets below this, data breach was a real issue and continues to be with remote employees. And again, monitoring work, that tied into productivity, and how do you measure productivity when someone's not in the office, they're hard to reach, and so on. All challenges with the COVID impact upon the workplace when you're talking about remote employees. So the government relief efforts, we all know what was happening back in March. The FFCRA, or the Families First Corona Response Act, that came out in March and effective April 1. And what did it mean? It meant emergency sick leave and emergency family leave, but they were the categories, as you all know. And the emergency sick leave was up to a maximum of 80 hours, and again, for employers with fewer than 500 employees. And the same was true with regard to emergency family leave. The family leave, however, was not typical FMLA. It was only if the employee's child's daycare or school was closed. And of course, now with reopening, there are challenges in that regard. But there were lots of questions, and the Department of Labor has been very busy turning out their FAQs, and there have been interesting things in that regard. And it's going to get even more interesting, I would argue, between now and December 31st, when the end of the FFCRA, at least assuming that is not extended into 2021. You may have had employees already use that time, and then they have to rely upon other forms of leave, or either paid or unpaid leave, and so on. We'll talk about that in a second too. Federal stimulus checks. Well, that one batch already went out, and they're talking about a second. Congress is talking about a second batch, but it's tied up in Congress at this point. CARES Act. CARES Act was a great, that followed the FFCRA, that followed the stimulus checks, but that was it had two parts to it. The Payroll Protection Program, which we know talked about stabilizing payrolls, because of course in March and April we saw a flood of furloughs and terminations and layoffs, and that had a detrimental effect. Unemployment in February nationally was below 4%, 4% being full employment. In New Hampshire, it was 2.5% in February. And when everything fell apart, nationally, it went as high as 25% unemployment. That is sort of the Great Depression type numbers. Now, thankfully, as of last week, we're down to below 8%. Some border states like Massachusetts higher. It depends upon the industry, but the numbers have been coming down steadily. But the Payroll Protection Program was intended to just that, provide some relief to employers to maintain payrolls. Now, there were other expenses that were included in that, but basically it was money from the government if you applied. And as we all know, there were 2 rounds of that. And that the issue was you had to maintain the head count from the measurement period. And if you maintain that head count, and there are some limited exceptions, then the loan was forgiven. The payroll protection loan was forgiven. And again, that was for employers with fewer than 500 employees and so on. And if you did not maintain the head count and you did not otherwise meet the requirements, it was a low interest loan. And some employers accepted that as a potential consequence. It was lower than what you could get from a commercial lender. Now, there has been some fraud and abuse in that regard, but the government is chasing after that. The other part of the CARES Act was the augmented unemployment benefit. And there were several senators that spoke up and said, wait a minute, that's schizophrenic. On the one hand, you're trying to restore and maintain payrolls. On the other hand, you're actually creating an incentive for people to stay on unemployment. What was that incentive? In addition to what the state provided for unemployment, and in New Hampshire, the maximum benefit was over around $420 a week, the federal government provided an additional $600. So whether you're making $200 plus $600 or $400 plus $600, that was a substantial benefit. And for some employees, they were making more money on unemployment, and there were certain tax benefits as well, than being employed. So employers were complaining that the CARES Act, while well-intended and certainly necessary for some unemployed employees, it also created some friction where some employees chose to stay out of work and claimed a reason for that, a COVID-related reason, and the threshold was low. That too has been changing. That benefit ran out July 31st. There were discussions in Congress to increase that again or to restore that. The president resisted that. The president proposed a $300 a week in an executive order. Only a handful of states have adopted that to date. And that's really the push and pull that we were talking about, paycheck protection versus the CARES Act. That has effectively gone away in one regard, but the residue of that, or the remainder, has been that some employees still resist the return to work. And we'll talk about that because it really gets back to the focus of today's presentation, which is providing some assurances to your employees that the workplace is indeed safe and it is safe to return to work to the extent necessary. So reopening, it has its own issues. As we look to where most employers are right now. Most employers are back to at least a 60% census for return to work, density of the number of employees in the workplace, with the many protections that most employers have put in place following the CDC guidelines and the New Hampshire guidelines for New Hampshire employers, but other states have those as well. But there are some challenges, of course, as we're now into the school year and have been now for a couple of weeks, depending upon where you are. Each school district in New Hampshire, the SAUs are all very different. And even within the SAUs, the cities and towns are different. Schools either closing completely or partial opening, and a hybrid practice of some in person and some at home. That presents its own challenges, because if you're calling employees back to work, they may not be able to come back to work full time because they're at least part of the week, the school may be closed and they don't have adequate care for the children. Some of the other issues that come up are the CDC guidelines as they continue to evolve, and New Hampshire daily screening requirements. So we all know what those are, and a lot of employers scrambled to back in May and June to set up those policies, procedures, and protocols for purposes of getting ready for the employees as they return to work and phase back in. So we all know what those are, the 4 questions about being exposed, having symptoms, travel, and the like, but also temperature taking. Now, temperature taking has sort of been debunked as being an indicator as to whether or not someone has the virus, because you can have the virus in you and you can be contagious and not have a temperature yet. But that's still a part of the protocols. Do you have a temperature over a certain number? And that usually it's about 100 to 100.1. And if the answer is yes to any of the screening questions, of course, we know that the employee is not allowed to return to work. Either they have to quarantine for 14 days or get a negative COVID test. The PPE compliance in the workplace. How many of you have had issues with employees resisting wearing masks? I've seen all manner of masks, and I'm sure you have as well. Everything from the cloth mask to the mask that someone took off their work desk that was meant for carpentry and things like that, to, yes, I've even seen a Halloween mask. It was a joke, but I did see a Halloween mask. We've seen the clear plastic face shields and others. And of course, you see people sort of modifying them. We have a new look out there. I call it the Abraham Lincoln, people dropping their face mask below their chin, which of course we know is not an effective way to wear the mask. But I think, or people dropping it just below their nose so they can breathe properly. Certainly challenges in that regard, but the issue is, for purposes of PPE compliance, if you have a face mask policy, and you should, by the way, New Hampshire says, as a lot of other states do, you can require visitors and employees to wear face masks in the workplace, in common areas, and in areas where employees and others cannot safely socially distance. And what is that? More than 6 feet apart and not being in close proximity for more than 10 minutes. Other employee safety concerns, it goes really back to, I don't feel safe. I don't think my my coworkers are acting in a safe manner. I don't think my employer is acting in a safe manner. They're turning a blind eye towards symptoms. It's production over safety. Or they, I work for a group that doesn't believe the virus is real. We've heard it all. And of course, you've got also just, again, concerns about, where other coworkers have been, if they've traveled, or if the employee themselves have traveled, or if they have underlying health conditions, or their family members do. You've probably seen it. We've seen lots of it. Healthcare professionals are being super cautious in this regard and encouraging people to stay home if they have any concerns whatsoever. That doesn't necessarily sync up well with the employer's obligations or requirements for return to work, and sometimes there is tension. There are changing state guidelines. For those, and I'm sure most of you HR professionals have been monitoring this, state by state, and most employers in New Hampshire have operations beyond the Granite State. You have to monitor almost on a daily basis the state guidelines because they do change that rapidly. You know, whether we're talking about quarantine or travel or stay at home or limiting the number of people that could be gathering. I saw this morning that in the UK, starting this week, you can't have a gathering of 6 or more people. Some states it's 250 people. Some states it's 50 people. So you really have to look at that for purposes of your density in your workplace or any larger gatherings. And there are lingering quarantine issues. What does it mean? Traveling over the border for a neighboring state, there are highway signs that say, welcome. There's a COVID testing area at the visitor center, and if you're here, unless you're commuting for work or essential business travel, you have to quarantine for 14 days. Well, we're just coming out of the summer vacation season, and how many people would stay in a hotel room for 14 days? We know that that generally didn't happen. But we also know that there have been clusters and surges because people were not abiding by quarantine issues. So, and that will continue to be an issue going forward until such time that this virus has abated or has been dealt with a vaccine or otherwise. Legal issues associated with the return to work, and there are several, and they're not always, as we saw with the CARES Act and others, they're not always as integrated as they should be, as you would hope they would be. And remember, to be fair to Congress, and I don't say that often, but to be fair to Congress, the FFCRA was basically put together, cobbled together in a little over a week and passed. When was the last time you heard any legislation being put together that quickly and passing? And similarly, the CARES Act that followed was in a relatively short trajectory. And with that, you're going to have problems. Some anticipated, some unexpected. So the legal issues that come up would be the Family First Corona Response Act, benefits and compliance. The benefits, of course, you have to know who's eligible, tracking their time for purposes of are they taking emergency sick leave or family leave, and knowing that that record keeping has to be solid because that may evolve into other benefits. You may have paid time or unpaid time, but also you want to get the payroll credit for employees that were eligible and took that time, and there will be a reckoning. FMLA benefits. Some run concurrently with the FFCRA, some don't. And so knowing the difference between the two is important because you want to avoid either a non-compliance issue with the FFCRA or a retaliation issue under the FMLA. Workers' comp issues. In some states, that's more of an issue than it is in New Hampshire. In New Hampshire, there was an attorney general opinion that basically said, given the nature of the virus and the difficulty in proving causation, you got it in the workplace as opposed to the supermarket or at home or elsewhere, that generally speaking, that COVID would not be deemed to be an injury arising out of work, generally. Not all states, in fact, I think the state of California basically assumes if you have COVID, you probably got it at work, and therefore it's a claim against your comp carrier. So it's a state-by-state analysis and one that's worth looking at. And you cannot rest exclusively in the fact that it may not arise under workers' comp, because workers' comp actually is a benefit. The benefit is because that's an exclusive remedy available to employers for purposes of dealing with a workplace illness or injury. If that's not available, you might have a negligence standard and you don't have the protection of the insurance. ADA accommodations has been a big one, because the question is whether or not the person has a disability, or, as we talk about a couple of points down here, they're caring for a family member, so it's an association discrimination claim. But that's a big one as to whether or not work from home is a reasonable accommodation. Staggered work shift is a reasonable accommodation. Not wearing a face mask, is that a reasonable accommodation? I'll talk about that in a minute. HIPAA privacy obligations, that's principally dealing with a healthcare provider and you maintaining the employee health records in accordance with the ADA and also with HIPAA. OSHA safety standards. Well, first of all, if you have an outbreak in the workplace, that could be deemed to be something that's reportable on your OSHA 300 log. But it is also something where OSHA has adopted the CDC standards for purposes of workplace safety. So everything from wearing masks to quarantine to one-way hallways, hand washing, things of that nature. OSHA is very active right now, and we've got a few clients that have OSHA audits going on right now based upon employee complaints. And the word from the OSHA inspectors is they're very busy with these complaints, COVID-related complaints in the workplace, and PPP compliance, because there will be auditing for as to whether or not the loan is forgiven, if there is loan repayment, or if there's been fraud. And that is all coming along soon enough. And again, borrowing on a movie reference, we're going to need a bigger boat from one of my favorite movies, Jaws. So as workplaces reopen and some or most or all employees return to work, how can we ensure that the workplace is indeed safe? Here are my recommendations, and there are others out there. We've been circulating some on LaborNet recently. And by the way, for those that are not members of LaborNet yet, New Hampshire LaborNet, we encourage you to be a part of that discussion group. We've had that, we created and we host that discussion group, and it's been in place since 1996, believe it or not, and it's still wildly popular. We have, I think, 2,000 HR professionals in New Hampshire and beyond, and it's a great information exchange, and especially in this time for HR professionals, there's been a great deal of traffic in the last several months, sharing policies and just back and forth with regard to the practices as we get employees back to work. So some of the recommendations that we put together in a checklist would be a checklist for a safe return to work is adopt and communicate clear policies. And what do we mean by that? These are things that you've already done. Clear policies with regard to daily screening of all employees, your CEO, your COO, down to your dock worker, loading dock, your temp workers and the like. Everyone in the organization subject to the daily screening and attestation. Early on in this process, of course, that was designated areas where employees would come in a queue and stand together and have their temperature taken and fill out the 4 questions. That has long since gone away, where now it's largely employees attesting to that they don't have a fever and that they answer no to the 4 questions. Masks and social distancing, but I'll go back to the policies. Employers should be keeping those records, going back to the workers' comp issue, going back to the OSHA issue, going back to alleviating some fears of employees. You're keeping records that you've at least done the threshold of we've asked the questions and we're hoping employees are honest about answering the questions, at least at the start of the workday. But that's not the end, of course, the inquiry and the monitoring. Masks and social distancing. New reality, of course, and I think people generally speaking get this, generally speaking, but there are some who resist. But I think making it clear what your expectations are for purposes of travel in the workplace and otherwise, but also in the workplace, wearing masks when social distancing is not possible, but also in certain areas requiring them altogether. Conference rooms, lobbies, hallways, and the like. Bathroom use, single use. That's largely been the norm for employers, but that has its own challenges as well, depending upon the nature of your facilities, whether it's single sex or unisex bathrooms and how many you have based upon the population you have. But employers have had to deal with that because multiple occupants in a bathroom area, usually it's a smaller space, and there are concerns about the virus, and so not necessarily on the surface, it's just airflow. The same is true with kitchens, limited use in that regard. One-way corridors and hallways, conference rooms, having a limit on time and a limit on density. The number of, I have a client that has a 25% density requirement in the conference room I'm sitting today. we've removed a lot of chairs, and we limit the time and the number of people that can be in rooms like this. And again, limited time for interactions. You can keep it short, or there are alternatives: text, email, phone, as opposed to face-to-face. Interesting one that's come up is limiting standing desks. Well, we all know the benefits of standing. My smartwatch tells me to get up and stand and walk around, but by standing, you're actually potentially, especially in open concept workplaces where you've got cubicles, potentially exposing folks to your exhale unnecessarily. So we've actually seen a lot of employers saying, don't use your standing desk, at least during this period of time. And when you do get up and leave your area, of course, you're putting your mask back on. Sufficient spaces between work areas. Before COVID, a lot of workplaces were reconfiguring, and some of them are going to open concept, going back to open concept, I should say. Many of those plans have been scrapped because of COVID, and you're creating more physical barriers, whether it's office space or barriers to foot traffic, and requiring people to go one direction or another, just like we've seen in grocery stores or other places. Ensuring proper ventilation, if at all possible. What does that mean? Opening the windows, opening the doors, or allowing employees to have little fans in their area just to keep the workflow going, the airflow going rather, and the workflow. No shared spaces or equipment. Again, with open concepts, a lot of employers were looking at, we'll just have modules that people can use and when they're here. Largely that's gone away. No shared equipment, no shared spaces, more segregation and more single use. And signage everywhere. Masks, hand washing, encouraging people that didn't learn when they were in grammar school or otherwise about how to cover when they cough or sneeze, and that was on cue. And then the question comes up with regard to signage: does it have to be in more than one language? You cannot insist on an English-only rule, of course, but you can. And if you have several predominant languages in the workplace, it's probably a good idea to have other languages in those postings, not only for that signage, but also your policies, as you've done with other workplace policies. Hand sanitizing stations. Again, if I knew what was coming down the line, I would have invested in Lysol, hand sanitizer, Home Depot, and Best Buy shares. Hand sanitizing, I think, by the way, also, to take a brief aside, if we can figure out the connection, remember the shortages back in March and April, toilet paper, chicken, pasta, and soup. If you figure out the connection between those four, it's the Da Vinci Code for COVID. You could have solved the question, solved the problem. I still haven't figured it out. I've called Tom Hanks a number of times. He hasn't returned my calls. Back to the checklist. So hand sanitizing stations, having them not only in general areas for your visitors, in your conference rooms, in your common areas, but encouraging employees to have them in their workstations and in their desks. No shared food or beverages. That means not only just on leaving food in the kitchens, but also birthday parties and other celebrations. As we come into the fall and holiday season, you're largely going to have not issues like that. One, because of density, and two, because just sort of the sharing of food is generally frowned upon. The same is true with beverages. No non-essential travel. Most employers are basically still limiting business travel. And then the question comes up with regard to personal travel. A lot of employers have reported through SHRM and otherwise that employees have not been honest about where they've been traveling. Why? Because either they would have to quarantine and work from home, or if they couldn't work from home, they had to use their PTO. So employees were basically, oh no, I didn't go to Disneyland. These mouse ears, oh no, I've worn this for years. So, or this, this magnificent tan that I have. No, I've been at home. So I think you can't prohibit employees from personal travel, but you can ask them as a part of the questioning, have you traveled? Have you been exposed to? Do you have any symptoms, and so on? And the quarantine expectations remain the same, which is if you answer no or don't answer the questions, and that's another thing that's come up. If you refuse to answer the questions, and I've actually had a few clients that have done this, they didn't believe the employees, and they did Facebook stalking, and they said, you lied. You said you didn't travel, but I've seen on your Facebook that you indeed were traveling. I don't recommend that. That's just kind of creepy. You trust employees as much as possible, and make it clear what your quarantine expectations are. For travel outside of New England right now into the hotspot states, or if you've had people travel in from out of states from the hotspots and you're in close proximity with them for an extended period of time, more than 10 to 15 minutes, you could have a situation where you have to quarantine. And again, going back to the FFCRA, if the person can work remotely, there's no FFCRA benefit. And if they can't work remotely, they've got the potential for at least the up to 80 hours of sick leave. And if that's already been exhausted this year, then it's using your PTO. It might be FMLA, it might be, or it's unpaid time. Or it could be, I guess it could be STD or LTD if the person is sick and they've run out of all other benefits. Have a system in place for reporting cases and outbreaks in your workplace. And also a system for managers and supervisors to report non-compliance, and also your coworkers to report non-compliance, because you want to know and you want to keep employees safe. And if someone is not complying with the screening questions or the proper safety practices in the workplace, you want to know because you want to address them promptly. And they have to be consequences for non-compliance. What does that mean? Like any other important work rule, and this is an important safety rule, if people are not abiding by it, there have to be consequences. And that could be discipline, that could be termination. Recommended safe practices. This one's fine with me. I don't mind handshaking, but that's pretty much gone away. It's the elbow touch or the elbow to elbow or even a fist bump, but even those seem to have gone away. No hugs. Generally speaking, no hugs. Even if the people are masked, people are keeping their social distance. Company parties and outings, for the most part, we're hearing on LaborNet and otherwise that employers have said nothing this year. I was inducted into the College of Labor and Employment this year. It's as a fellowship. There was supposed to be a big gathering in Beverly Hills in November. That's been put off, and instead it's going to be virtual. So I don't know if I'm going to be wearing a tuxedo and having a virtual conference, but it doesn't seem quite the same as being in person. And so I think that's true for a lot of workplaces. Largely, there will not be company parties or outings as we come into the holiday season. Update your sick leave policy and encourage more flexibility. That comes from the state guidelines and also from CDC to a certain extent, but mostly in the state guidelines. New Hampshire said, be flexible about your sick leave policy. Well, when you take together the FFCRA, your existing PTO policy or your sick leave policy, your attendance policy and others, I think the burden largely falls upon your HR professionals to monitor people at work, and if they've run out of time, whether or not they're going to be allowed to bank or borrow additional sick time or PTO time, or if it's going to be unpaid, or in the case of the salaried employees, whether or not you can deduct. And largely speaking, for salaried employees in New Hampshire, if someone has exhausted their sick leave, you cannot deduct from salary. Any work in the pay period, the person gets paid the entire amount with certain limited exceptions. Now, one of the exceptions is FMLA time, but if it doesn't qualify for FMLA time, because you can prorate salary for FMLA, the question is, if someone has exhausted their sick leave, what do you do? Well, even before COVID, it was you pay the full salary. This would be the person goes into a debit situation for purposes of their sick time. And if it's a PTO policy, it's all in the same kettle. And then the question would be whether or not this is vacation time or something other than sick time, or it's sick time. Again, a burden on HR professionals to figure out what it is and how to classify it. Regular deep cleaning of all work areas. Again, if I had any foresight, I would have invested in these cleaning companies because they're crazy busy, but staying after that as an employer and making certain that's done, not just when there's a COVID surge or outbreak, but when just on a regular basis. And it's not just once a day, it should be several times a day. And especially as we're coming into cold and flu season. Ensure contact tracing as much as possible. What does that mean? Knowing who's in your workplace, meaning visitors, clients, vendors, and of course your employees. Know who is there on a particular day. So should there be an outbreak, dealing with your local health department, dealing with your employees, notification. And the only way you're going to do that, and many of you probably experienced this going to restaurants in the last couple of months, where you provide a name and a phone number. In the event that there's an outbreak, you'll be contacted. And procedure in place for dealing with suspected or confirmed exposure to COVID. Some additional recommended safe practices. I mentioned this earlier. Minimize face-to-face contact. Instead, have text, email, calls. I don't recommend shouting down the hallway, but keeping distance for sure. Be flexible with your remote work policy. What does that mean? Not being rigid, saying you must be here at all times. If it is possible for an employee to work remotely, that should be something that is permitted. Again, focusing on density in the workplace. Stagger work shifts or having partial in-office weeks. That's all a part of the remote work policy, but also it's a part of when you have manufacturing or related facilities that you're staggering the work shifts for purposes of, again, workplace density. And be mindful of challenges for parents of school-age kids, either daycare or schools where they're staggering their opening or they're having the hybrid opening. And therefore, you might have a situation where your employee is working in part in the office and in part from home. And perhaps even not working at all because they have to care for kids. And therefore, that kicks back into the FFCRA benefit, which, remember, when the school is closed, when the daycare is closed, because the facility actually has to be closed. It's not when the parent opts out and says, well, it's open, but I choose not to send my kids. The FFCRA benefit would only be when the school is actually, or the daycare is actually closed, and the parent has no other childcare available. Then the FFCRA benefit, if the employee is still eligible and the employer is covered, that may be a benefit that both could take advantage of. Additional safe practices recommended. Remember, the ADA accommodations are on a case-by-case basis. What do we mean by that? That long predated COVID, and that really is about, you don't treat all back injuries, you don't treat all carpal tunnel syndromes, you don't treat all cancer issues all the same way. It's on a case-by-case basis, meaning the accommodations are, first of all, is the employee, does he or she have a physical or mental disability? And assuming that they do, then are they are they a qualified individual with a disability? Meaning, can they perform all the essential functions of the job with or without reasonable accommodation? Well, you have to define what the essential functions of the job are. And then further, you have to say, what is a reasonable accommodation? And it's almost arguing the alternative, which is, it's reasonable until it's not. What does that mean? It's reasonable unless it represents a direct threat of harm to the employee or his or her coworkers, or if it represents an undue hardship for the employer. What does that mean? That focuses on cost and effect upon the organization. Oftentimes, you focus on the effect upon the organization and upon the coworkers, the burden on them, and also you look at the duration. How long is this accommodation supposed to last? So, on a case-by-case basis, what does the law truly require? The interactive process, back and forth with the employee, and perhaps the employee's physician. What does this mean? How long is this going to be? Can he or she still perform the job as required with this assistance, this accommodation? Certainly monitoring workplace illnesses and being aware of your confidentiality obligations, confidentiality with regard to medical records. Update your workers' compensation carrier on your safety policies and practices. Even though you may not have an issue following that Attorney General guideline, you want to basically let your comp carrier know you've done everything you can do to keep your workplace safe. And that also ties into a potential OSHA audit as well. Consider safety compliance incentives. What does that mean? That means, like for those workplaces that once had, we've gone X number of days without a workplace accident, or we're going to reward you for not using your sick time. Well, we're not going to do that, but with regard to the workplace accidents, you might say we've gone X number of days without having a case of COVID or suspected COVID in the workplace, and rewarding the employees. Again, not with an outing, not with a party, but some incentives or just an acknowledgement. Thank you for keeping us all safe. Following the evolving CDC and New Hampshire guidelines is important because, again, they do change. And this one I've thrown in there, shut off cable news, because it's only going to make you crazy. And it's only going to amplify issues. The important issues. You can trust common sense, but you can also follow the CDC and applicable state guidelines. But shut off the talking heads on cable news. It's only going to make things unnecessarily complicated. So what happens if there is a case in the workplace? Well, you all know this. It's encouraged candor by the employees. We talked about that with regard to their travel and how they're feeling as they answer the 4 questions in screening. Train your supervisors to monitor how employees are looking. I traveled early on in this process back in March, and I was coming in from Europe. And as I was on the plane, most people, even at that early time, were wearing masks. And there was very little sort of service of food and drink. And that was early March. As I got off the plane, though, I was standing in line at customs, and I saw a fellow who was red-faced and visibly sweating. He clearly was sick. He clearly had a fever. Now, customs was not trained at that point in early March, and they asked the guy a few questions. He got agitated, and they just let him go. I turned to my wife and I said, "There goes patient 0." So training your supervisors and your managers to monitor and report where there is suspected illness, or encouraging your employees to come forward and say, I just want to let you know, I think so-and-so, whether it's coughing or sneezing. And of course, we're in allergy season right now, and people are coughing and sneezing, myself included. And that is something you want to be able to distinguish pretty quickly. And one of the things you're asking, of course, is any other symptoms. And you go through the CDC guidelines for purposes of, and also the World Health Organization guidelines for what could be COVID-related symptoms. And encouraging someone to seek out advice from their healthcare professional. Establish an emergency communication plan. What does that mean? In the event that there is a COVID outbreak, or even just one case, having a plan for purposes of notifying the employees and public health officials. Having a plan in place for purposes of quarantine and testing requirements before employees are allowed to return to work. Deep cleaning, of course, before they return to work, and plans for shift supervision or facility shutdown. And that would be a shift change for purposes of we're shutting down this shift altogether, or we're shutting down the facility altogether. But if you can segregate the shift, then perhaps that's the only thing that's being shut down. But otherwise, it might be the entire facility, depending upon the nature of the outbreak. More on that if there is a case. You have a point of contact with the employees. Now, if it's a unionized workplace, you're going to be contacting the union and otherwise having certain designated postings. But if you don't, you have to have an effective either intranet or other posting that you get to employees both in your facility and those that are working remotely. Medical authorization for access to healthcare providers. What does that mean? Well, you can't automatically contact someone's doctor. You've got to go through the employees, having a system in place for purposes of having, I have so-and-so's authorization to contact you, understand that he or she is your patient, and we need to ask the following questions. You can do that through the employee or with the employee's authorization direct to the healthcare professional. A plan for access to public health officials. What does that mean? Having a point of contact at your local Department of Public Health who's working in concert with the State Department of Public Health, but having that open line of communication to again avoid confusion. Training supervisors on what to say and what not to say. You know, supervisors oftentimes are referred to as your eyes and ears, but they're also potentially your Achilles heel. So you want to be certain as to training them on what to say and what not to say, not teasing people, not calling them out with the Scarlet C letter for COVID, and just being professional and appropriate when dealing with employees. Plan on when there is an all clear to return to work. And that, I don't mean in general in facing back, I mean after there's been a case and you've either had a section shut down or your entire facility. Add COVID-19 updates to your safety committee. If you've got 15 or more employees in New Hampshire, you have to have a safety committee that meets at least quarterly, and you want to provide those updates to the safety committee as well, just like you've done to your comp carrier. And most importantly, because this is the lifeblood of all HR professionals, document, document, document all actions taken after there's been a suspected or a confirmed case. There's some unique issues associated with COVID-19 that many of you have dealt with, and those include business travel, again, curtailing largely, mostly all of your business travel. While some have started to allow some travel back, it's not the way it was before, perhaps not by air. It might be limited travel by car, but even then, having certain protections in place, where they go, how long they're there, what they do, and so on. While you can't limit personal travel, you can ask employees if they are. So then there are protections in place for the screening before the employee is allowed to return to work again. Employee fear. This has been a really big one. And perhaps that's something you've experienced yourselves or that you've heard from the employees you supervise. But whether it's rational or not, I've dealt with this, gosh, countless numbers of time in the last few months where it's reported that employees don't want to return to work until there's a vaccine, don't want to return to work because of an underlying health condition or fear that they may be exposing someone else, and so on. That may be rational, that may be well grounded in a confirmed fact, or it could just be completely irrational. Before I talked about the duration of accommodations, we've seen a lot of those where it's until December, until February of 2021, until the next visit with the doctor in November, and so on. The answer is case-by-case basis, but the employee and his or her physician doesn't dictate. They can recommend. You decide as the employer. But an open-ended or an unlimited accommodation is, generally speaking, is not necessarily a reasonable accommodation. And the duration of remote work. How long will you continue to do that? Is that something the employee can have as well, you've allowed me to work remotely for the last 6 months. Why can't I do this going forward? I've been just as effective. Again, it's on a case-by-case basis, but you can say, we did that because of the stay-at-home order. We did that because of we want to get things in place for purposes of return to work and density, but now it's time to come back to work. And we also had concerns, frankly, about misuse, productivity, network security, and so on. We need you back to work. But there will be some employees that you're going to still allow on a case-by-case basis to work remotely, at least part of the week. And what happens when the FFCRA is exhausted? Well, they may have other benefits. They may have PTO, they may have FMLA, they may have STD or LTD, or it may be unpaid leave. But if you want to retain the employee, while that benefit may be gone, there may be other benefits available to them. What do you do when the employee refuses to return to work? Well, that has a lot of implications. One of them is with regard to your PPP loan, because you want to maintain the headcount. And you have to report, as you know, through the guidelines, report to the state unemployment office within 30 days of the employee refusing to return to work. That may provide some protection for you with regard to the headcount. But before you get to any of that, of course, you're going to talk to the employee. avoid the blanket rules, which, you know, as parents, we've all said, because I said so. As an employer, perhaps you can say that, but that's not the modern workplace. Talking to the employee, better understanding, because it might be something very simple. And there may be some confusion. There's a great deal of confusion out there. There's a great deal of misinformation out there. So I think talking to the employee makes a great deal of sense. And if it's not you, it's your supervisors, but you're training your supervisors on what to say and what not to say. The interactive process, again, is important for purposes of reasonable accommodation if the person is a disability, and we're having the back and forth. What do you need so you can perform your job? And what's involved? How long is that expected? What support do you have for that? And having that back and forth. Well, we can't do that, but we can do this. Does that make sense? Is remote work still possible? Well, if the employee refuses to return to work, and it's an employee you need to retain or would like to retain, can that person still work from home at least part of the week? And what proof or documentation do you need for purposes of the employee says, I can't come to work because I have an underlying health condition. I'm taking care of someone who has an underlying health condition and so on. And you're going to need, at a minimum, medical documentation, and you may actually have authorization so you can have some interaction back and forth with the healthcare provider. And again, avoiding that knee-jerk reaction. Oh, you don't want to come back to work? Fine, you're fired. Generally speaking, that is not the way to proceed. There may be instances where that is necessary, but generally speaking, I recommend talking to the employee and having that exchange of information. Woody Allen once said that 80% of life is just showing up, and some employers are now saying that with regard to work. Is a return to work necessary? If so, and leave benefits are exhausted, that could be the end of employment. But again, we want to be in a situation where we've done everything we can do to make certain that that workplace is safe and employees feel comfortable in returning to work. They understand what they're supposed to do and when they're supposed to do it. Everybody's on the same page with regard to policies, practices, and protocols. You're being consistent in that regard. But if you have that recalcitrant employee who does not have a good reason for not returning to work, that could be the end of their employment, and that would be unfortunate. But that is sort of where we are. I do recommend that you are careful in that regard, because we're seeing more and more retaliation or pushback claims, whether it's disability related or otherwise, FMLA retaliation and so on. So be careful. But there could be reasons why, and good reasons why, you are indeed ending someone's employment. Hopefully that is not the case, but that may happen. So hopefully this presentation has been helpful. Most of it you probably already knew, but this is an evolving situation, and there'll be much more between now and the end of the year. Stay tuned to LaborNet. Stay tuned to, we're having an upcoming reboot of our annual employment law seminar. Watch for that. We're going to be doing it in two phases, one in October and one in November. These and other issues related to COVID and other issues that have been happening in the workplace besides COVID in the last year, we'll be doing virtual presentations in that regard. So before we get to the questions, your questions, and we do have a bit of time, we've got about 15 minutes. We have a brief poll that we'd like to share with you folks. So take a look at that, and if you could take a minute to respond to those, that would be helpful. And I can read those if you like. First question is your company in a growth mode? Meaning, are you looking to expand, acquire, or be acquired in the next year or so? The second is, and it's a yes or no, and the second is, if you aren't in a growth mode, why is that? Checking one of these: slow business, not enough employees, insufficient capital, all of the above. The third question is, what is the greatest threat to your business right now? Government regulation, labor shortage. I'll give you a minute to go through those, check off your answers, and then we'll get to the questions. The last question, by the way, is one I was interested in, which is, as you look to the end of the year, which of the following concerns you the most? The threat of another COVID shutdown, compliance with the payroll protection program, the implications of opting into the recently announced payroll tax deferral program, or delinquent accounts from your clients and customers alike, so limited AR and impact upon your business. So we have a few questions. We have time for a few questions. I'm going to just pull those up on the screen here in a second. Thanks. One question that came up is, can you repeat the disadvantage of standing desks? Well, there are a few. One is the disadvantage of the standing desk, as it has been reported, is that people are standing, and if they're in the open cubicle or open concept workplace, you can be, as you're talking to someone else on the phone or talking to a coworker and so on, you could be, and if you're not wearing a mask, you could be sort of expelling potentially the virus to other people. By sitting, you're below grade, and you're hopefully within a cubicle, you're shielding yourself, you're distancing yourself from others. Employees have weddings, trips out of New England. Are employers obligated to use FFCRA and pay all of them for 14 days without using vacation accruals? Well, again, the FFCRA would only be an issue if they, the answer to the questions, there are 6 in there for purposes of qualifying, but with regard to no childcare or school closure would not be an issue. It would be only if the employee had symptoms, was asked to quarantine by a healthcare professional or by a government official, and that's the question that comes up. Is it a government official, because of the CDC and New Hampshire guidelines, that would qualify the person for FFCRA benefit for the emergency sick leave? So do you pay them for 14 days without using the vacation accrual? Generally speaking, under the FFCRA, if the person qualifies, meaning the person has not used the benefit yet, because remember, it's only 80 hours of sick leave, a maximum of 80 hours of sick leave at the employee's current rate of pay. And if they've used all of it or a portion of it, they only get the balance of that. But even then, it's only if the employee is, again, either quarantined or has symptoms or suspected of having COVID. If you follow the guidelines for purposes of, well, the government says if you traveled outside of New England into a hotspot, then, or, again, for vacation or for trips or otherwise, or weddings and the like, are you required to be quarantined? You could be quarantined. You have to use the FFCRA benefit before you use your accrued but unused paid leave time. And if you don't have the FFCRA benefit because either you're not covered by it or because you've exhausted it or your employer's not covered by it, then you would use your paid or unpaid leave time. I'm going to skip down here a little bit. Let's see. We currently require face masks in open area, including in our open in our office, which is composed of cubicles with about 5-foot walls in between. If the employees are sitting at least 6 feet apart within these cubicles, can we allow them to remove their mask while sitting at their desk? The answer is yes. Because again, you're at least 6 feet apart, right? And while you're in the same area for more than 10 minutes, you're at least 6 feet apart. And so I think the answer is yes. The person can, in their work area, as long as there's a physical and barrier and a distance between them of at least 6 feet, the answer is yes. They can remove their masks. If a person has to quarantine for 14 days after a personal trip, I lost that one. It skipped, let's see. There it is. Does the employer still have to pay them? I think we answered that. It's whether or not they qualify for FFCRA or paid leave or unpaid leave. If there's work available outside school hours, can the employer require the employee to change their schedule rather than pay them through the FFCRA? As a healthcare agency, it is a severe hardship not to have staff. I think shift changes, certainly, and saying to the employee, you know, we need you to work these other hours. And if you're going to take FFCRA, you've got that benefit. That to me is a conversation you're going to have with the employee. In other words, I can't work and I have to take care of my kids. The school's closed, or the daycare is closed. I'm going to take care of my kids, so I can't work remotely, and that's an FFCRA benefit potentially, right? But can you ask them to work beyond those? It all depends on the one that they have adequate healthcare. Adequate childcare beyond those hours. But remember, as a healthcare agency, as a healthcare employer, you may be exempted from the FFCRA. Or you can also have a cafeteria approach to the FFCRA where you say, look, we'll provide the emergency sick leave, but we're not providing the emergency family leave. And you can do that and still get the credit. So says the Department of Labor. That's a unique one to healthcare providers. If someone exhausts their FMLA and has COPD and cannot show up to work and has numerous ADA accommodation, should the person apply for LTD or be terminated? Be careful in that regard. Really, again, it's the interactive process. The person may not be able to perform their job. The question is, can they perform the job at home remotely and therefore not exposed to issues in the workplace? But if they can't perform the job, yeah, you may want to look at short-term disability or long-term disability benefits. And should they be terminated? That should be a last resort, but it might actually be self-termination if they go on LTD, because it basically is, it's not an automatic rule, but if it's indefinite long-term disability, I can't perform the work at all, that may end the person's employment because they're going on that long-term disability benefit. If an employee's child is on hybrid school schedule, are the days at home for remote learning covered by the FFCRA? The only time that the FFCRA, this comes from the FAQs from the Department of Labor, would apply would be when the school itself is closed. The building itself is closed. And hybrid learning would be when the school is closed itself, but it's learning from home. So that would be an FFCRA benefit for that time. I'm looking at a few more questions here as we're winding up. You mentioned about the employee refusing to answer health questions. Can you talk about what companies should do for those employees who are pushing back to answer that they feel are private? You know, my answer in that regard is we're dealing with a pandemic. You can say, look, answer these questions and likely we won't have another one of these crises for another 100 years and you can resist then. But in the meantime, this is not only your health and safety, but the health and safety of your coworkers, and that should override, or that should be the greater concern. So my view is, and this actually comes from the FAQs as well, if an employee refuses to answer, it's as if they answered yes, and therefore they are not allowed to come back to work. You know, whether you've seen protests about people not wearing masks or certain privacy rights and so on, my view is those privacy rights are subordinated to the greater public interest at this point because we're dealing with a public health crisis. If a child has been sent home from school due to a cough and cannot return to school without a negative test, would you recommend making the parent stay home with the child as well until those test results come back? That's an interesting one. You don't know that the child has necessarily been exposed to COVID, or if it's again, we're coming into cold and flu and even allergy season. You could. I think I would certainly look at the child is at home. You might not have adequate child care. The parent has to stay home with the child anyway. So it might be an FFCRA benefit for the parent to stay home with the child. I don't know. I think that that's probably a belt and suspenders approach, having the parent stay home as well. It would be better. You don't have FFCRA if the person can actually work remotely while the child is convalescing or waiting for test results. Someone just asked, will your presentation be available? Meaning our PowerPoint will be available, and the answer is yes. For those that have registered, yes, that presentation will be available. It's in a PDF format, I think. And, you know, and these are sort of best practices based upon my experience and the experience of members in our employment group over the last 6 months, but also with regard to everything that we've read and everything that you folks have seen. And again, it evolves almost on a daily basis, and lots of very interesting questions that come up. And I guess, generally speaking, I don't doubt the sincerity of employees that say that they have underlying health conditions or that they have concerns about returning to work. But I think, as President Reagan was once said, trust but verify. So asking for support information, even then having that dialogue with employees. I do think this has been helpful. I hope this has been helpful. There's lots going on. We're going to continue to post on LaborNet. We're going to continue to have these webinars. Look for our announcements with regard to the reboot of our annual employment law seminar in two parts in October and November. Stay tuned, stay safe, and thanks for being part of this today.